What we see now is the short axis view of the internal jugular vein vessel, and we can observe the diameter, elasticity, and anatomical positional relationship between the vessel and the surrounding adjacent vessels. Through the long axis view, it can be judged whether there are foreign bodies in the lumen, whether there is a change in the direction, and whether there are plaques, stenosis, etc. And the color blood flow mode can be turned on to further judge the vascular filling and thrombosis. The subclavian vein can be seen under the clavicle. It is easy to squash under pressure, and it can be judged whether the tube wall is elastic, whether there is thrombus, whether the shape is normal, and whether the blood flow is unobstructed. The internal jugular vein, subclavian vein, and axillary vein are also important blood vessels that need to be positioned for puncture and catheterization during central venous catheterization, and are important references for monitoring whether the catheter is displaced or dropped. Clinically, when positioning the central venous catheter, it is necessary to find the internal jugular vein, subclavian vein, etc., under ultrasound guidance, so as to greatly improve the success rate of catheterization, reduce clinical risks, and relieve patient suffering. The clinical common carotid artery is often used to observe and evaluate the blood flow status, determine whether there is plaque or stenosis, click color Doppler mode to observe the blood flow pattern, and click PW mode to observe the blood flow velocity measurement.